continue to have significant constraints. But I think for me, what is truly, in my mind, is unique about this is that these 6 building blocks, for the first time, we have a local solution to our biggest healthcare challenges. We have seen private sector companies come together to have a Nigerian platform to solve our health challenges through innovation. These 6 building blocks include the following. Essentially, what this health innovation map does is that it undertakes a detailed mapping of existing health innovations in the country. It focuses on all of the analytics required to understand where we have presence in terms of innovations, where the gaps are, what the policy and regulatory insights we need to spur innovation will be. By Health Innovation Hub, we really just mean a convergence platform that allows different actors of the health innovation marketplace interact, both in a virtual perspective, but also in a physical way through our annual summit. This portal does is that it, in a sense, will have a library of archives, whether it is journals, whether it is analytical pieces, data from the public sector, things that we need for you all to understand the kinds of innovations that are needed. That has been missing. I am pleased that with all of the partnerships that we have with many states, many innovators, many public sector agencies, we have MOUs so that we have a pipeline of data to support innovations in Nigeria. We also believe that this knowledge product bit will allow us to ensure that the community of practice, which I'll talk about later on, that there are complementarities, right? It will help to inform the sorts of priorities that people that are interested in innovations can sort of focus on. This is very interesting as an alliance because it is very easy to talk innovation with little action, right? We need to go beyond conceptualizing ideas to demonstrating results through innovation. And so what we are focusing in this building block really is to demonstrate tangible results through innovation. We have many private sector members that are part of the Private Sector Alliance who have agreed to bring to bear their capabilities, right? Some of their assets to innovate, to save lives. So what we try to do here is to, for want of a better term, engage many private sector companies, put innovative ideas in front of them and get them to use their own capabilities to contribute to this Saving 1 Million Lives movement. And this really is, ultimately, after we identify promising innovations to put on the Innovation Hub, so the likes of Kuson Technology, who are primarily technology companies, what can we do as an institution to ensure that we build their capabilities so that they understand how to achieve scale in the health sector? We are partnering with institutions to develop bespoke curricula that meet the needs of both our early and later stage innovators so that they can create more scalable and sustainable innovations that contribute to our efforts to save 1 million lives. I think that this is exciting, and I'll tell you why. Because we have in the past done a number of competitions. That is never enough. We were part of the Healthcare Hackathon, which was a competition that was just focused on technology for healthcare, right? But how can we do more to support our movement to save 1 million lives. So this is the journey. Two things in this portal, right? One is Health Innovation Challenge. Now what this is it goes beyond just technology. It speaks to innovations in service delivery. It speaks to market innovations. It speaks to policy innovations. It speaks to anything innovation. So what we have done to bring this to life over the last few months in partnership with Solina Health, Dr. Muni, who is here, we have engaged some of the most important stakeholders in the health sector to bring up problem statements. So what we have here today are problem statements that have been outlined. I'll tell you what I mean by this. We want to ensure that our innovations are focusing on the right challenges. Healthcare is a very fragmented space, and so it is its innovation, right? Because today, for example, we have someone that is into telemedicine. We have another one that is into developing apps. Another that is into developing databases. Another Riders for Health that are into supply chain and delivering care through innovation. My point is that when we say innovation, it means lots of things to lots of people. And the learnings within each of those segments is not being coordinated in a manner that allows us learn as well as ensure that it aligns with our country's priorities.